Yeah, so what we now need is to get this into the doctor's practice. And there are first attempts now already made by some companies who produce classical seizure diaries as apps. And they offer the option also to integrate first device data so that we can compare what is being provided in terms of data from the patient side on the one hand and from the side of objective data on the other hand, and integrate that and see how well that correlates and see how that is also influenced by other factors. So if we have a smartphone-based assessment of patients, this allows also to integrate additional data. So it can integrate, for example, data on mood. It could integrate data on sleep quality. It could integrate data on just general activities of a patient, on the intake of medications, how regularly is the intake, has it been forgotten at some times. It could integrate some menstrual cycles into our documentation. And by this, it can both help to directly see how the situation is at a given time point, but it can also help to understand if there are factors that we can recognize which can influence if seizures will occur at a higher risk or not. So these are the so-called seizure cycles or cycles of seizure probabilities, which can then be detected, and it can be very interesting in the future to learn if we can identify factors in an individual patient which are relevant to seizure preponderance, and then can be relevant either to change behavior or to improve intake of medication on the one hand, but also maybe to predict such periods where patients are at a particular risk and then warn patients that there is maybe a higher risk in a given period of time that a seizure might occur. There are certain cycles of seizure propensity which have come into the focus of the field of seizure forecasting during recent years. And these cycles probably have a number of different factors which contribute. So everybody knows about circadian cycles, and it has been very long known that there is a difference in the propensity to have, for example, focal seizures during frontal lobe epilepsy compared to temporal lobe epilepsy in terms of their circadian preponderance. So this is one area. So we have circadian changes, which may be related to hormonal changes, but also to other factors that directly influence the excitability of cortical neurons. But we also have learned that there are, beyond these circadian cycles, there are longer lasting cycles. The best known is the catamenial epilepsy, which occurs in relation to menstrual cycles. But it has turned out that this is not limited to women, that we also have multi-DN or multi-week cycles in male patients, so independent on these hormonal changes. And I think there are a number of factors that have been identified in some short-term studies, mostly in inpatients, which can influence the probability to have a seizure during a certain period of time. But now we are going into a field where we really assess this over weeks, where we assess this over many months. And there have been already recent publications also from a group where we are participating in the My Seizure Gauge project, which is supported by the Epilepsy Foundation, that in principle you can also base prediction performances which are significant on such multi-DN cycles. And so the interesting question for the future is, what is the relevant factors? How can we best identify these cycles? Is it sufficient to rely on patient reports on seizures, or is it not? So in my personal view, it is not, so that we have to integrate, again, objective data and patient-based data when we want to assess such predictions, because also the cycles that patients report are not objective data, but they depend on their ability to report. And there is a particular underreporting during night time. So that we really, in order to have a complete picture of this, have to integrate wearable data, we have to integrate EEG data in order to assess these cycles objectively, and then learn what is the best way to predict and to identify factors and to use this in practice. And I think there are major steps being done just in this period of time.